Company.
It's time for answers to your medical questions and get an inside look at the latest in healthcare, technology, and treatments. This is Rex on Call. Welcome to Rex on Call, live on WRAL. I'm Sharon Delaney for UNC Rex Healthcare. Today, we're talking about wellness and weight loss in the new year. If you're watching us live and you have questions, they could be answered by our experts. Our guests today taking your questions are Dr. Shane Hemphill from Rex Primary Care of Cary and Jessica Tucker, an exercise physiologist at Rex Wellness Centers. To call us here at Rex on Call, just dial the number on your screen, 919-744-3876. If you're watching us as we stream live on WRAL.com, you can email us your questions, rexoncall@rexhealth.com. Find us on Twitter and send us a message at Rex Healthcare, #RexOnCall. All right, so a show of hands. How many of you have made those resolutions to lead a healthier life this year? Me too. Well, it is so typical to take inventory of our habits, both good and bad, at the beginning of a new year. Today, we're going to give you realistic advice on how to get started with reaching your goals, from assessing your current lifestyle to figuring out what's attainable for you to what kind of sleep you're getting. These all play a role in getting you off to a good start. One place where this is the focus, Rex Wellness Centers.
I feel young.
And Bobby Perry looks young, younger than his years. At 70, he is healthier now than when he was 59 and packing an extra 40 pounds.
I feel more energy when I work out than I do if I'm just at home.
His secret? Bobby is very active, working out here at the Rex Wellness Center in Wakefield 7 days a week, sometimes twice a day. While step aerobics is his favorite class, Bobby does it all.
But I also do the aqua classes, I do the cardio classes, strength classes, I do the cycle classes, I do the yoga classes. I just love the classes.
Rex Wellness Centers offer a variety of classes for every level, from beginners to advanced, even fit and boot camps.
We're able to speak to people who are just beginning their workout program or people who are looking for that high intensity workout without a lot of stress to the body, and really try to emphasize safety.
And although they're sweating it out, exercise physiologist Jessica Tucker says the consistent theme here is to have fun while getting fit, giving members many times an unexpected benefit.
They just feel better. They're in a better mood. They feel like doing extra things in their lives.
The most important thing to keep in mind when you start an exercise program is to pick something you can sustain for longer than 3 months or 3 days, because your goal is to make a member a happy chronic exerciser. Jessica, tell us what you mean about that, a happy chronic exerciser like Bobby.
Yeah, I mean, Bobby's a great example of someone who has been an exerciser for longer than 3 months. He is someone who's been an exerciser for longer than 10 years, and that is best case scenario. We want to find someone who's plugged in to doing something they love and doing something they don't feel like is a chore. So we mean for someone to be an exerciser beyond 90 days and hopefully for the rest of their life.
And clearly Bobby is an exception. I mean, 7 days a week, twice a day is more than most people could probably commit to.
Sure, I think if you're in Bobby's situation, you have a lot of time and it's a really creative and productive use of your time, but not everybody fits into that, into that mold, so.
All right, Dr. Hemphill, as we talked about, Bobby really is so unique in that he can commit that much to his routine, but not everyone can do that. So what should people do to get started with an exercise regimen as far as seeing their doctor first?
Well, definitely. I mean, it's always a good idea. One, check in with your doctor. Get checked up. Hey, let us know. Hey, doc, I'm thinking about starting an exercise plan or an exercise routine, and come see us. See if there's anything that we can do to make sure that you are ready for that. And obviously, you want to make sure that you're starting something slowly, as I'm sure you would explain to your patients as well. But definitely have them come in and see us, have a consultation with us, and say, all right, doc, I want to start this year, this 2016 off right. So what do I need to do to make sure that I'm prepared for that and I don't injure myself?
So check the engine, make sure it's all
tune
tuned
the
out.
parts, absolutely.
Okay. Jessica, one of your sayings, which I wrote down when we were talking before the show, is frequency, not intensity.
That's right.
Tell us more about what that means.
Yeah, I mean, if we want someone to have exercise in their routine or their daily life from this point forward, we really want to make sure that they're focused on the frequency with which they do exercise. So a lot of times intensity will leave you with an injury or a lot of soreness, and that can really be disheartening for someone, especially a newer exerciser. So we want to make sure that they're building in exercise to their daily routine, at least 30 minutes every day. Even 7 days a week is fine, but we want to make sure that they're building time for that in their daily life.
Make it like a part of the habit, just
Absolutely.
like taking a shower or eating your breakfast.
Absolutely. It should be part of what you do every day, and it's sort of like eating a meal or eating breakfast. It's just part of your day.
Dr. Hemphill, as Jessica explained, intensity can be a bad thing because if someone injures themselves, then they're going to have a tough time keeping up with a routine.
Right.
Can you just start with something like walking? Could that be beneficial to your health?
Absolutely. You can even start. You can start with walking. We can even start and back up a little bit. They've actually came out with recent studies that say if you even stand instead of sitting, just stand, you actually can lower your blood pressure by increasing your metabolic rate. So just even getting up and just standing for a little bit versus sitting, and then doing very gentle walking. Start with something even across your carpet to the mailbox. You know, set small little goals that you can do, and don't be too hard on yourself. We all fail, but that's okay. We continue to try every day to make ourselves better.
Okay. As far as folks who put this big goal in front of them at the beginning of every year, as an exercise physiologist, what is something that you can try to trick your mind or make yourself believe to make it last more than that first few weeks?
Yeah, it's a good question, and I think a lot of times what we see is we see people who are fresh off the couch, and they really have these great intentions for the new year, and they're very excited. I think the thing to remember is to, start low and go slow.
Start low and go slow.
Yeah, for sure. That's a good way to make sure that at the end of March, you're still doing all the things that you had planned to do and set out to do at the end of December.
Is there an optimum number? You talked about frequency being important, but if we're starting low and slow, what would be the ideal number? Say, okay, I'm going to start this week. How many days should I commit to doing something?
Yeah, I think Dr. Hemphill really hit the nail on the head. If you're doing nothing, I think that doing 10 minutes a day is a beautiful thing. That's exactly where you need to be starting. And then if you have bigger goals for yourself, like weight loss, you're looking at things like 250, 300 minutes a week. But of course, we don't go from 0 minutes to 300 minutes. We start with 10 minutes. And remembering, meet yourself where you are realistically. Let's say you're doing nothing. Let's start with 10 minutes every day. That's a perfect way to get started.
Okay. And weight loss isn't always a goal. Should it be more, let's get healthy?
Absolutely. Yeah. Again, setting small steps for yourself, set small goals for yourself. It's not about let's just aim and lose 10 pounds in the next week. Let's talk about, all right, how can I do this healthy? Check in with your doctor. Get out and start something small. Like I said, stand up, start walking, start doing activities, but set a limit. Maybe write down activities. All right, today I'm going to walk for 5 to 10 minutes, and I'm going to check a box that says I did that, and I'm going to feel good about that. And if I don't do it, if I miss a day, that's okay. At least you have a plan and a goal, and that's all that you can ask to do.
All right, getting started. Yeah. All right, well, we are coming right back after the break to answer your questions. Just give us a call or send us an email. And as we go to break, Rex Wellness Centers make it easy for anyone to get started on the road to better health. There are 5 state-of-the-art facilities around Wake County in Cary, Garner, Knightdale, Raleigh, and Wakefield. Visit rexhealth.com for more information. Welcome back. This is Rex on Call live on WRAL, and today we're answering your questions on wellness and weight loss. If you have questions for our experts, call in now at 919-744-3876, or you can email us your questions at rexoncall@rexhealth.com. All right, so Nazi has called in asking, previously was a very active person, but now wheelchair bound. What can she do in her wheelchair that would still provide some activity?
Yeah, I think, I thank you for your question. First of all, I think that you're fortunate in that you can remember that activity and that you had a lifestyle that was previously, not sedentary, and you do want to continue to exercise. I think the key to where you are now is to make sure that whatever it is that you're doing is something that you can safely do. I think safety has to be the primary goal at this point for yourself. I think that there are a lot of things that you can do with bands, resistant bands, and there are a lot of things that you can do for like upper body ergometry, and you can
Ergometry? What does that
ergometry.
mean?
Yeah, it's
Oh,
like an
okay.
upper body bike.
Okay.
Yeah, there's a lot of great things you can do with the upper body, and maybe having someone work with you 2 to 3 times is probably the best way to get started, just to give yourself some material to work with, so you have a little bit of variety. I think is probably the way to go about it, first of all.
So like coming to a Rex Wellness Center, they can get some direction on how to, the different things to do.
Come to a Sit and Be Fit class, or come to a class where we're sitting down and doing most of our exercise.
Okay, all right. Dr. Hemphill, Cindy from Clinton wants to know, she has diabetes, she's trying to lose some weight, watching carbs, was able to lose 10 pounds, but stubborn belly fat.
Sure.
Is that a dieting thing, or is it exercise, or is it combination?
Yeah, it's probably a combination of things. I mean, when you initially start to lose weight, obviously you may lose it a little quicker. Some of that actually may be water loss, but over time though, eventually you're going to reach a threshold or a plateau, and then you need to start working and trying new things. Again, be creative, work with your primary care doctor, consider seeing a dietitian, see either physical therapist if you need that, to try some new exercises, but you need to change up your routine and try new things so you can break that plateau and reach a new one after that.
Okay. Brenda from Raleigh wants to know, she has arthritis in both knees and uses a cane to walk. Should she be doing exercises for her knees?
Oh, absolutely.
Jessica?
Yeah, I mean, arthritis, there's, over 100 types, but osteoarthritis of the knee is pretty prevalent, and you sort of get stuck in a pain cycle of pain and sedentary, and so you wonder, is movement even going to do me any good anymore? And I really try to impress upon these patients that motion is lotion. This is the time to get moving.
Motion is
if you
lotion.
can get past that first 5 minutes, Brenda, you really are going to do yourself a very big service, even with that pain. So if you can sort of keep a pain journal, or maybe do some things that just remind you that the gain that you're going to get is so much better off than just continuing to sit there and really give into that pain.
Okay, all right, great advice for Brenda, thank you. What about, Edith rather, from Lewisburg, what is a good exercise for sclerosis of the spine? And is that something that is an injury, or is that age-related?
Right. So again, it would be, I definitely would have the patient follow up with their primary care doctor. It would be good to find out what the actual etiology of the sclerosis of the spine is, where it may have come about, if there's some family history of it. And then as to what you can do for it, obviously if there's specifically pain associated with it in certain areas, possibly an evaluation by either exercise physiologist or a physical therapist, someone specifically who's trained to deal with certain areas of the spine would be recommended, and it can be documented and followed accurately.
Before starting something.
Before starting
Okay.
something, absolutely.
All right, and
yeah.
by the way, it's Edith's birthday today. Happy birthday. Pat from Rocky Mount, what do you put on an injured knee when you have fallen? Heat or ice? You always hear both. Heat or ice first, then heat, or is there?
Such a great question. I think it depends on who you ask, really. Anytime we have an acute injury, if you're not sure of what's going on underneath there, ice is always indicated in that first 24 hours. Certainly, Dr. Hemphill would probably have some better advice for that.
No, I absolutely agree with that. First 24 hours, get some ice on it for
Ice
sure.
first,
But if you get
okay.
up in the morning and it's extremely stiff and you can't move it, maybe a little heat pack on there or a warm shower may help to improve mobility of it.
Okay. All right, coming up, we'll have more of your questions answered live. Call 919-744-3876. Email us at rexoncall@rexhealth.com. Welcome back to Rex on Call. We are live here on WREL, and to reach us, just call 919-744-3876 or email us your questions to rexoncall@rexhealth.com. We all know that it's important to get a good night's sleep, but you may not realize how not getting enough sleep can affect your life. Things from sleep deprivation can affect your memory, your metabolism, mood, heart health, and your ability to fight off infection. A former non-believer about sleep tells his story.
According to my wife, I snored, and I used to get up 3 or 4 times during the night. And I was tired during the day, and when I drove, I was tired.
But Kurt Barnhill attributed his constant sleepiness to atrial fibrillation, or AFib, an abnormal heart rhythm that causes rapid and irregular beating.
And you can wake up in the middle of the night and you can't breathe.
But a couple of years ago, someone suggested he get tested for sleep apnea, an idea Kurt thought was ridiculous.
How can putting a mask on you and just running air through your nose make you feel better?
Skeptical, he visited the Rex Sleep Disorder Center and was sent home with an overnight self-monitor. The results the next day were shocking.
When I brought it back and they read it, it said that I had 27 times I guess, woke up.
The next step? An overnight stay here at the sleep center, which mimics a hotel, to be fully monitored, including brain waves, oxygen flow, and heart rate. His results?
I was waking up, over 44 times during the hour.
An alarming result, says Dr. Adnan Pervez, who says exhaustion is dangerous, with sleep related to almost all our bodily functions.
Cardiac problems, things like high blood pressure or arrhythmias, and there's a lot of exciting research coming out in the field of memory and dementia, premature aging. Sleep has been linked to things like weight gain and poor control of diabetes.
Kurt is a believer now that a good night's sleep can change your life.
I don't take a nap in the afternoon anymore. I'm not tired. I don't get tired when I'm driving. Anybody that snores, anybody that's tired during the day, if you're an AFib, try it. It might not work for you, but it sure worked for me.
The center can diagnose several types of sleep disorders, including sleep apnea, narcolepsy, restless leg syndrome, hypersomnia, and sleep issues with children. And there are other treatments that sleep apnea can include would be like dental devices, surgery, and weight loss. Now, there are 5 Rex Sleep Center locations in Wake County to serve you, including Raleigh, Cary, Wakefield, Garner, and Knightdale. Go to rexhealth.com and search sleep disorders for more information. Plus, at the website, you can take a free sleep-aware health assessment to help you determine if your risk of a sleep disorder is real or not. You can call 919-784-1465 to schedule an appointment. Now, Dr. Hemphill, what are some of the symptoms that you tell patients to watch for that might signal they're having trouble sleeping or there might be a sleep disorder?
Well, a lot of my patients will come in and say, Doc, I'm so tired during the day, I almost need to have a nap during the day. I'm groggy. Sometimes I get headaches when I wake up in the morning. Or I wake up, like I said, you slept for 8 hours, but you feel like you slept for 4 or 5 hours. And these things, obviously, as they were alluding to earlier, these can have some serious effects to your health.
All right, so some of those things are pretty scary statistics.
Absolutely.
Heart health and all sorts of.
Oh yeah, absolutely. It can affect, sleeping problems as one of my wellness things that I recommend for 2016. If you have problems with your sleep, that's one of the biggest things that you can work on, is try and improve that, because it can affect from not only your memory, but your blood pressure, increased risk of diabetes, heart problems, arrhythmia, the whole 9 yards, and there's no medication as good as getting good sleep.
All right, and one thing that can help you get good sleep is exercise, right?
That's right.
Jessica, talk about how that really factors in.
Yeah, I think exercise is a great way to relieve some stress. It's also a good way to just sort of get your heart rate up for a purposeful reason other than having to be somewhere at a certain time during the day. It really can have a relaxing effect and really affect your sleep quality.
I think as parents, we always tell our little ones to go run around a lot so they're tired and will fall asleep at night. Why do we not do the same thing for adults, right?
We should. We definitely should. It works the same way. We all are, we're built to move. And if we can bring ourselves up during the day, it's much easier to come down in the evening.
Okay. Is that part of the assessment when you bring in a new patient, when you're onboarding someone new?
Yeah, we always, we really encourage every member to come through a fitness assessment. And as part of that assessment, we ask about sleep quality, both duration of sleep and quality of sleep.
All right, with the sleep quality, some people may not know how poorly they're sleeping, right?
Very true.
Are there any indicators aside from going to the sleep center that would tell you, other than what you were saying, some of the symptoms, you're tired no matter how long you sleep?
Yeah, definitely. So daytime somnolence, morning headaches, really just fatigue, exhaustion. Obviously, those are the big things. But as you know, there can be other things. If you're not getting adequate sleep, that's a stress on the body. So your stress hormones are always firing. So you may have irregularities in your blood pressure as well, or your heart rate may be erratic. So there can be a lot of signs or symptoms from that.
Do you find that people are getting less and less good sleep nowadays because we all tend to have a screen in front of us right
Yeah.
before we're going to bed, right?
Absolutely.
Isn't that a deterrent to good sleep?
Oh, absolutely that. Well, not only that, I feel like a really big thing we need to just back up and take a step back and say, all right, let's look at our diet. I mean, so many people have a lot of caffeinated beverages or have alcohol. They don't get enough water. They're not getting out and exercising. They're not working on their mind. All of these things can affect the quality of sleep that you get.
All right, so again, really to drive this home, that to get off to a good start, no matter what your fitness or diet goals are in 2016, good sleep has to be a part of that.
Yeah.
Okay, all right, regarding the things that you do when someone says, all right, I'm ready to pull the trigger, I'm gonna join a health club or Rex Wellness Center, what is the first thing that they will see or expect when they come to see you at the Rex Health Center, Wellness Center?
It's an exciting time. A lot of times someone's really motivated when they come in, and that's a good thing for us. You come in, we try to welcome you from the very beginning at the front desk. We make sure that you know where you're going. A lot of times people really experience low confidence when they start an exercise program.
Intimidating when you walk
Yeah.
into that gym full of fit people.
Yeah, they're worried that perhaps they're a little bit behind as far as their fitness level, or they're taking the wrong class, or maybe this just isn't the right place for them, but it truly is the right place for everyone. And we want to make sure that you feel confident walking in the door. So we really encourage you to meet with us, and we can at least meet you and get you started. We can show you how to use the equipment. We can tell you which class would be the best class for you to start with, and we can certainly sit down and have that coaching session where you leave feeling like you really did make a good decision and that you're about to do the right things that you need right now to really, improve your health, which is really the reason everyone comes through our doors.
Yeah, improving health, not just sort of
Absolutely.
losing weight. That's a
absolutely.
byproduct of good health.
Yeah, exercise, as far as weight loss is concerned, it helps to maintain your weight. It's not a great way to just go about losing weight. There's so many things that are involved with that, and we want to make sure that people are coming in to improve their health. And most of our members are indeed doing that.
Excellent. All right, well, we will have our final round of questions right after the break. This is Rex on Call. Welcome back to the show. This is Rex on Call. We're taking our final round of questions right now. Yvonne would like to know about this drink that it's considered a diet drink to help lose weight. It's vinegar, honey, orange juice, and paprika. Have you ever heard of this sort of thing? I know it's something similar I've used from the Food Babe to kind of cleanse. Any ideas with this sort of formula?
I mean, when you're doing a cleanse, I guess the big thing just to be careful of is a lot of the cleanses that are out there can really cause a lot of diuresis. You can cause a lot of problems with them. A big thing, again, is just be careful when you start these things. Again, make sure you have routine blood work done. Make sure you've been evaluated by your primary care provider before you start a cleanse like that,
Okay.
because there can be some serious side effects from those.
Sure. Okay, Beverly has an artificial knee. Can she run with this, or does she need to do other low-impact exercises, Jessica?
Yeah, it's a great question, and we see a lot of knee replacements coming through the Wellness Center, and I think that largely depends on who you ask. There are physicians who say, don't run with a knee replacement. There are physicians who say, it's time to take up the elliptical or maybe some swimming. But I really think having that critical conversation with her doc is the place to start.
Okay.
If she's been a previous runner, that's gonna really tie into that answer, really.
Okay. All right. Thank you so much, Jessica and Dr. Hemphill. And as always, do consult with your physician about any health concerns you're having. And if you're looking for a doctor beyond today's show, or you need a direct referral, you can call Rex HealthNet. It's a free telephone information service provided by UNC Rex Healthcare. The number's on your screen. It's 919-784-4490. Thank you to our phone bank for taking the calls today. And we'd love for you to join us next month. It is Heart Month for our topic, which is cardiovascular care and innovation. That is on February 22nd. You can email your questions ahead of time to rexoncall@rexhealth.com. We'll see you next time.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.